Hello, my name is Arya Javidan and I'm the project manager for the National Consortium of Telehealth Resource Centers. Welcome to the latest presentation in the NCTRC webinar series. Today's session is on optimizing virtual care and is hosted by the Pacific Basin Telehealth Resource Center. These webinars are designed to provide timely information and demonstrations to support and guide the development of your telehealth programs. Just to provide a little bit of background on the consortium, located throughout the country, there are 12 regional telehealth resource centers and 2 national, one focused on telehealth policy and the other on telehealth technology. Each serve as focal points for advancing the effective use of telehealth and supporting access to telehealth services in rural and underserved communities. A few tips before we get started today. Your audio has been muted. Please use the Q&A function of the Zoom platform to ask questions. Questions will be answered at the end of the presentation. Please also note that closed captioning is available and that is located at the bottom of your screen. Today's webinar is also being recorded and you will be able to access today's and past webinars on the NCTRC YouTube channel. And with that, I will pass it over to Chrissy Kuahine, Director of the Pacific Basin Telehealth Resource Center.
Thank you, Arya. Aloha, everyone. It's my pleasure to introduce our speakers today from Waianae Coast Comprehensive Health Center. Chrissy Kuahine is the Director of Clinical and Patient Informatics, and Leina Kanana is the Chief Community Health Services Officer of Waianae Coast Comprehensive Health Center. Waianae is one of our largest federally qualified health centers in the state of Hawaii. And we are so happy today to share with you their story and highlight their innovation and their fantastic work over the years with telehealth and health information. I know they have a very full agenda today, so I'm going to turn it over to, I believe, Chrissy, who will be starting it off. Thank you.
Aloha and good morning. This is Chrissy Kuahine from Oahu, Hawaii, Waianae. And what you see in the background, I like to put this up because folks always think it's somehow a picture of, something fictional that comes out from some artists. But this is really me standing on one of our buildings, taking a photo of our coastline, standing on our family medical building, which you should see. I'm sharing my screen now. So that's the building on the left-hand side of the slide. And so it always just is a real reminder for me of how blessed we are to be where we're at, our community, and then being able to serve our population with all the wonderful services and including telehealth. And so I am the Director of Clinical and Patient Informatics. My role is I oversee our electronic medical record department and of course our data and telehealth that came up in 2020 is with all of you. And I've been here for 33 years in different roles, and I am very excited and am grateful for the opportunity for allowing us to share what we're doing here out in the middle of the Pacific. I'm going to turn it over to Leina to go ahead and introduce herself and then get us started.
Hi, aloha everyone. My name is Leina Kanana, and I'm, as I mentioned, the Chief Community Health Services Officer here at Comprehensive. I've been here for about 22 years now. Yes, Chrissy and I both started when we were in high school. But my background is in social work, and I've been heavily involved in the social services and enabling services here at the center. And I'm excited to just share with you how we use technology and we integrate that into our care here. Go ahead.
Oh, Leina?
Yes.
Oh, so sorry.
Oh, sorry.
Yeah.
No, sorry, I didn't see that. Okay, I saw the switch now. So
okay.
Let's see. We were established in 1972 as community response to the lack of healthcare providers available here on the leeward coast of Oahu. Back in the 70s, when the sugar mills have shut down, there was no healthcare. The healthcare that was offered to our community members was provided by the sugar mill companies. And so when that shut down, many of our community members had to travel about an hour and a half on a bumpy road down to downtown Honolulu to receive healthcare. And so with the innovation of some community leaders back in the 70s, they put together a plan to build a community health center here that's centrally located on the Leeward Coast. And so we've grown from a 1 doctor office, where we're about 5 or 6 staff, to being the second largest and oldest of the 15 FQHCs here in Hawaii. We're the largest employer on the Leeward Coast, on the Waianae Coast, where we employ over 600 employees, and most of them are residents of our community. And so when I talk about Leeward Coast or Waianae Coast, this here is a picture of the island of Oahu. And so when I say Leeward Coast, it's everything you see on the left side here in that kind of pink coral shaded area of Waianae, or that 96792 area. These little dots here are all of our service sites, or most of our service sites that we have operational. So we have our main center, and then we also have several satellite clinics in neighboring communities such as Kapolei, Waipahu, and Ewa. And then we also are operating school-based health clinics in 3 schools, 2 high schools and 2 middle schools, sorry, so that's 4. And then we are also branching out to elementary schools in the new school year. Next slide. Our services are really comprehensive, thus Waianae Coast Comprehensive Health Center. They range from adolescent health, adult daycare, all the way down to our WIC, vision, transportation. Most of our services are offered here at the main center, and then we have some services that are offered at our satellite clinics. So our satellite clinics kind of operate as just little mini clinics, but they're fashioned like the main center here. We also provide telehealth visits. You know, the COVID pandemic has really pushed us into the telehealth world, where we just was starting to get our footing on telehealth and just started training providers. But with the pandemic, we did a fast run into the telehealth realm, and we're now full-fledged. We have many of our behavioral health and medical visits are done via telehealth here. We also have what we call the comp at a Tamura supermarket, where we put up a kiosk in a local supermarket here in Waianae. If you're from Waianae, you definitely know where Tamura supermarket is. It is one of the most major supermarkets here. And so what better place to set up a kiosk where right in your local grocery store, where you can pick up your groceries, pick up your medication, and stop in to see your provider all at the same time. So the population we serve, and last year in 2022, the health center serviced just over 35,000 patients through just over 120,000 in-person visits and just over 78,000 virtual visits. So lots going on here at the center. Our demographics consist of a mixture of Native Hawaiian, Asian Pacific Islander, and Caucasians. We do have other ethnicities that do use our services here, but these are the 3 major groups here. The socioeconomic status of our patients are where we have about 70% are below the federal poverty level. 3% are uninsured, which we pride ourselves in that very low number there. And then about 10% are receiving coverage under Medicare and are dual eligible. And then about 60% of our patients are Medicaid, or our Quest, we call the coverage we call it here in Hawaii is the Quest coverage. So about 60, I think right about now we're probably at about 65% that are receiving Medicaid coverage. Some indicators of the population that we serve. So this here just kind of gives you a snapshot of the area, the community, and then our county, which is the whole island of Oahu, and then the state of Hawaii, which are all the major islands. So for those living 100% below poverty level, for our community, we're at 22.4%, whereas the Honolulu County, our island, is at 8%, and the state is at about 10%. For our households receiving SNAP, our community is about 34%, where our island is at about 10 and the state is about 11%. Our income for our community is averaging around 21,000. Our county for our island is about 35 and the state is about 32. So you can kind of begin to see the socioeconomic indicators and the risk of the community and the population that we serve. For our household receiving, for our children receiving assistance, for Waianae, we're at 55%, whereas the state and the county are in the 20s. And then for those with no high school degree or diploma, for Waianae, we're about 7%, whereas our county and our state is averaging around 4%. This here, we recently gave a presentation to individuals in New York, just discussing about the cost of living. And I'm sure some of you who are here from Hawaii can relate to this. Others on the mainland, I can just indulge you of the cost of living here in Hawaii. That picture there in the middle is a legitimate picture of a home that was for sale here in Waianae for $500,000, 2-bedroom, 1-bath, 644 square foot. Whereas you can get something much larger, much more spacious, much more beautiful in Arizona. But that just really depicts to you the struggle of the cost of living here in Hawaii, where for groceries, you can get so much more on the mainland considering what you can get here in Hawaii. The picture on the left, on the right, sorry, of the family there, we wanted to just share with you the multi-generational living that we have here in Hawaii. Because of the cost of living is so high, many families, mine as well as Chrissy's, we live multi-generational, where we have our parents and then ourselves, our children, and even grandchildren are all living under the same roof. And it's for many reasons. One, like I mentioned, the cost of living, but it's that ohana spirit that kind of helps keep us going and drives us. And it also helps to keep our kupunas younger when there's our keiki or our children in the home as well. So you'll find many homes here in Hawaii where people live like this, multi-generational. It's not much heard of, on the mainland, but this is our style of living here in Hawaii. And the picture on the bottom right, where you see those in wheelchairs holding up signs, this was a protest of Native Hawaiians on the island, on the Big Island of Hawaii, and on the Big Island of Hawaii. And this here is just to show you the resilience and the strong culture that is here in Hawaii, where no matter if the cost of living is high, people are struggling socially or economically, there's still that resilience, there's still that ohana, and there's still that strong cultural ties to our native lands and our native culture. Next slide. Oh, I'll turn it over to Chrissy.
All righty. So thank you, Leina, for setting the stage in terms of the population that we serve and our community. I think the two things that really stand out are how unique we are in terms of our Native Hawaiian population, but also to the challenges that we face for living in Hawaii, the cost of living, and all the other socioeconomic indicators that Leina presented. Now, despite all of that, our adoption of emerging technologies, really we have not let that stop us in helping our community advance in terms of improving health outcomes using technology. And I didn't have it in this presentation, but usually I have a really great slide that shows what our mission is. And I think it's really telling in what our vision, our mission, our passion in terms of technology and being able to improve the quality of life for our community. And that is, besides being a healing and teaching health center, we are innovators. And so, and this mission was created years ago, and making sure that we use emerging technology to help improve our community's health, and that goes even beyond their health, but also all the other social determinants of health that we know impact our patients and our community's health. So first thing was we adopted an electronic health record system. We actually purchased NextGen is our EMR. We purchased back in 2000. And so we've had an EMR system for 20 years. And for a community health center to do that, not using grant money, using our own money, I think that is really telling in terms of what it kind of vision our CEO Rich Bettini, and our healthcare team, our executive team had in knowing the importance of technology and the importance of data capture. And of course, being able to access patients' information regardless of what location they showed up at. One of the reasons we went with NextGen is we're able to customize our EMR templates. We have a little over 1,000 either customized, so created from scratch, or out of the box templates that we were able to modify. And why that's important for us, and we didn't really emphasize this, but we not only provide here at the center Western medicine, but also Native Hawaiian healing. We actually have a Native Hawaiian healing center here that provide traditional cultural practices such as lomi lomi in English, massage therapy, but also ho'oponopono, la'au lapa'au. So using medicinal herbs, and then ho'oponopono is a non-traditional way of not risk. Leina, help me out here. I can't think of the word.
Conflict resolution.
Yes, conflict resolution. So sorry. Yes, thank you. And so certainly out of the box, you're not going to have any of those templates to document any of those services that are provided. We also we're a lead agency in developing the first SDOH or prepare survey. So the social determinants of health instrument tool that is now being used all over the country. So this was, I want to say, Leina, about 7 to 9 years ago or 7 years ago or so. So it's been a while.
Yes.
Yeah. And so what we've done on our end is we've actually modified the SDOH tool that we use quite a bit. And I think we're now at probably version 7. And the reason why we modified it really was so that we could track and collect most appropriately based on our community's needs and how we are able to better serve them. We talked about poverty in our community. And so when we talk about implementing telehealth, there are certainly challenges when it comes to broadband access, so internet access, when we talk about affordability, and then even digital literacy. So we'll talk about that in the next few slides. We've seen that the average family income for our Native Hawaiian population is $18,000 per year. So thinking about whether or not you're going to pay for internet access versus putting food on the table for your family, or even gas in your car to get to work. Those are the kind of challenges that our community is facing. And despite that, we were able to rapidly transform our in-person visits into telehealth visits at the start of the pandemic. Before I go into that, I think one of the things that really, and this is not just for us, but this is something that all organizations have come to realize, and it has really been highlighted at the height of the peak of the pandemic in 2021. I think we all realized that there was a digital divide that existed between the haves and have-nots, but really what has come, I think, to light is the fact that one of the social determinants of health is really digital inclusion. So if you think about all the things that are now exclusively and probably solely only accessible online, you start to think about those that don't have either the ability because of affordability or even geographical. So really they are unserved because they just don't have the connection. Or if they do, they really don't have the digital literacy to use the internet in a meaningful way that contribute to all of the social indicators that we know at the end of the day are also contribute to healthcare outcomes. So in 2019, we had no virtual visits. It was all in person, but that isn't to say that we weren't thinking about it. So I think, it was fortuitous for us that in 2019 we had already selected a telehealth platform, and that's Mend, and we had already purchased licenses, so we had gone through that process. Of course, we were planning to roll it out as we do any other project with, you know, 6 months, and then you have an implementation. Well, 2020 pushed all of us off of a cliff, and we either had to fly or, you know, speed quickly to the ground. So lucky for us, we did not have a day where we weren't able to service our patients. So although we closed our physical doors, we were up and running with telehealth as soon as our stay-at-home order was officially announced. So just very quickly, we were able to use an ad hoc function, which is just starting a televideo visit, either texting or emailing to our patients. But we were able to train over 100 providers in 10 days. We had all of our providers, so these are our specialists, not including our emergency room. We do have an emergency room here, but all of our primary care, behavioral health, and our specialty providers all trained by August. And then we had an integrated with next-gen appointment scheduling in September. And so we had rolled out to all of our providers and locations. Just some of the things I think if folks are still trying to roll out a particular vendor, or you're still trying to expand on your telehealth platform in terms of adoption, these are some of the techniques that we used. So we set up Zoom sessions just like this one. We left them open 3 days in a row for 8 hours, and we just had folks, and this was open to everyone. So not only our clinical staff, but every single employee in our health center. So HR, billing, whoever wanted to experience Mend as a patient would log in, we'd send them a televideo link and then start a session. 2 things for that is, as Leina mentioned, more than 50% of our employees are from the community. So what better way to get the word out about, hey, this is telehealth, this is how you get connected, these are the benefits, than going through your employees who are your community members, and quite a few of our employees are also our patients. So that was super successful, getting people to experience it when they were available. We also had for the in-person visits where folks had to come in, if time allowed and the patient had their cell phone, the MA or clinical assistant would go ahead and demo with an ad hoc function so that they would get that training in person for their follow-up telehealth visit. And then we also created a position, or I guess I want to say repurposed a position into a telehealth patient education specialist at that time, who would contact patients ahead of time to make sure that they had a device, did they know how to use it, and then run through a test if they needed to. The other thing that we looked to, and our CEO, Rich, who was very excited when HRSA came out with the Optimizing Virtual Care Grant, is something that we were looking forward to and had applied. We're one of 29 health centers who are awarded through HRSA an Optimizing Virtual Care Grant. The other community health center on Oahu who received it is KKV, so Kokua Kalihi Valley. And really the purpose of the OVC grant was to use telehealth digital tools to open up, and in our case, our goal is to increase access to care, because at the end of the day, if your patients are receiving care, whether it's in person or via some telehealth modality, whether it's televideo or telephonic, it's care. They're receiving care. And so we want to make sure that we reduce any kind of barriers, whether they're technological or in some cases, digital literacy. We want to make sure that we're able to offer that as a service and additional service, because we know anytime that we can provide care, it's going to help our patients in terms of healthcare outcomes. One of the great things about this grant is you had to make sure that you wrote in sustainability. So that's a little bit different, I think, from some of the grants that we typically apply for. So that was one of the criteria. You had to show that you had some idea of how you were going to sustain whatever it is that you were going to put in place. Some of the OVC these are the strategies that we had determined that we were going to focus on for our grant. So telehealth service kiosks. Leina had mentioned one in Tamaras. We also have one in our Eva clinic, who was sponsored by Aloha Care, one of our Quest peers. We're going to be looking at very cool news video that was just done recently on our Timura's kiosk. So I'm excited to share that. Telehealth support services. And so this involved not only providing services through our telehealth kiosk, but also providing digital literacy. And so we'll see that in the upcoming slides, how we offered free Kupuna. So in Hawaiian, that's our seniors, Kupuna computer basic, very basic 001 computer classes. And they walked away with a free refurbished laptop. And so that's all kind of wrapped up in our support services. We're also looking at remote patient monitoring, so offering care management in patients' homes, so for those at-risk patients. And then we're also developing a CompHealth Connect mobile app. And so this is something that we're currently developing and hoping that will be a one portal for our patients to go to, our community actually to go to, for not only their patient portal information, but also for community-based social services and resources. And then the last thing that we had looked at and we are super excited about is our HIT innovations in terms of integrating advanced augmented intelligence, I like to say augmented intelligence, analytics and machine learning and NLPs, natural language processing, you'll see in the next few slides. Just to give you kind of a snapshot of where we are in terms of telehealth adoption. And I think really on the right-hand side is what folks are interested in is why it is that our patients, and probably in most cases, why many patients are not able to conduct a full televideo visit and have to opt for a telephonic or audio only. On the right-hand side, this snapshot, it was about a month ago. We're at 75% in person on the telehealth side. We're at the 25%. I just looked at our last statistics yesterday, and so we're at about 85% in person, and then the rest are between televideo and telephonic. So as you can see, our telephonic has decreased. Some of those have gone into the in-person. The others, in terms of televideo, we've been able to address the things like digital literacy, and then with the ACP program, which Leina will talk about, affordable connectivity, being able to address affordability. On the right-hand side, you'll see these are numbers from last year, but they've actually stayed pretty consistent. So again, over half of our patients have either poor or unstable internet connectivity. So it's one of those things when we talk about broadband access, we really have to think about what is meaningful. So you might have access to the internet, but is it really strong enough for you to maintain a telehealth visit? Is it really strong enough for you? And as Leina talked about, a multi-generational family, if everyone is on the internet, can anyone really do work? Can you engage in distance learning activities, or even work from home? We have a certain amount of folks that don't have camera-enabled devices. We also have those that don't have any internet access, and that can be due to affordability and or geographic barriers. So they just don't have fiber to their home or any other means of accessing. And then we also have patients who just do not know how to use, so that's the digital literacy of video app, and that really has declined. I've been able to help folks. What I found, at least just in my own personal assistance with patients, is I have quite a few patients who have phones, and they typically, if they're older, their children or family members are purchasing a phone for them so that they can stay connected. But it's usually, if it's a brand new iPhone or Android, besides picking up the phone and answering it and maybe texting, there's not a whole lot they know about their phones. So that's where the digital literacy part comes, is how do I even use the device that I have? One of the things that we also incorporated into identifying the challenges that our population faces. So of course, not only finding out what the barriers are, but how do we track the services and resources that we're providing them in terms of, in this case, telehealth. So as Leina mentioned, we've been actually tracking enabling service codes for about 30 years now. So, and talk about data rich. We definitely have a lot of information on care enabling. So again, these are these services that we provide that we typically are not reimbursed for. As you know, for the CHCs that are on this call now, you totally understand where I'm coming from. So the things like providing transportation, helping family members with their mom or dad to get to a specialist in town, or even explaining what kind their medication list and why they have to take it. In this case, we created our own telehealth care enabling codes. You can see if there's education provided, resources, or referral. That is all tracked in our EMR. And so we're able to systematically track, monitor, and then report on how these types of services impact our patient outcome. So looking at our telehealth patient assistance services kiosk, we have two, like I mentioned. So one in Tamura's on the left-hand side. That's just a visual of what that space looks like. It's about 100 square feet. So it's not very big, but it's adjacent to our community pharmacy that we also have in that grocery store. One of the cool things is we are using, we have two video platforms that we use. One is Mend, and then we also use Tidal Care. If folks who are on the call who are not familiar with Tidal Care, it really is a very cool device that allows for a physical exam with your remote provider. So what you're seeing here in the picture is a tool that and it can be anyone. It doesn't have to be a certified medical assistant. In our case, the kiosks are manned with outreach navigators that can help use the tool so the remote provider can visualize the patient's eardrums. They can listen to the patient's heartbeat. And you'll see that in the next slide with the news report that was just filmed a little bit ago. On the right-hand side is just if anyone is interested, there are different ways that you can set this up. So besides something on the left that we have, an actual room dedicated to a telehealth kiosk, if you're looking to set up a mobile, flexible way to use any of your exam rooms or for behavioral health, for that matter, you could use Office. We've put iPads on rolling carts that we can move them to whatever location the provider needs to connect with when their patients are being seen via televideo. So this is the news story that we're going to take a look at in just a sec. I'm going to stop sharing my screen for just a moment, just because I realized I didn't include share sound. So let me do that. Okay.
Telehealth has been a lifeline for many patients, especially during the pandemic.
As KITV4's Chrissy Kuahine reports, a community health center is now taking it a step further to make it even easier for people to get proper medical care.
In Waianae's biggest store, Eva Galariata Rosa bought her groceries and got a quick checkup, too.
Hi, good morning, Eva.
Good morning, Dad.
How are you doing today?
I have a little ear problem going on.
Tip it up a little bit.
From his office about a mile away, Dr. Stephen Bradley examined her while she sat in a small kiosk in Tamura Supermarket.
And he can see everything as if he was right in front of me doing it himself.
Access to healthcare is a huge problem in rural neighborhoods across the islands. And with this tool, a community health center has found an innovative way to give patients the care they need. After monitoring her lungs and heart, the doctor called in her medication to the pharmacy in the next room.
Okay, I called it in, so you'll be able to pick it up in a few minutes.
Okay, thank you very much.
The kiosk is part of a strategy by the Waianae Coast Comprehensive Health Center to bring medical care to patients plagued by chronic health problems.
Finally, it's coming to places like Waianae, where, to me, the need is the greatest. This is where the pathology is the most serious.
Patients can also get other services, including help signing up for health insurance, food benefits, and even housing assistance.
Not only your healthcare needs, so the cough or the runny nose, but also those things that we know really impact a person's healthcare outcomes.
The center also runs a kiosk in Eva and hopes to open more to improve care in West Oahu. For Eva, it's a lifesaver.
This is so convenient. This is the best thing that actually happened in our community.
Christine Concilio, KITV4, Island News.
So talk about one-stop shop. We also offer, because this is a HRSA service location, we do offer transportation to this location. So our patients are picked up at their home. They can see their provider, pick up their medication in the very next room. And then as you saw here for our patient, Eva was able to do her grocery shopping, and then she can get back on transportation and go home. And so we're very excited about that kiosk. We also have another kiosk that is located in Eva. So that is one of our service sites. And again, that one was funded by Aloha Care, our Quest payer. And so we really, truly appreciate their help in supporting that site. That one we use for behavioral health as well as primary care, so acute types of visits, as well as patient assistance services. One of the things I'm going to gloss over just very quickly, one of our projects in addressing the need for access to internet as well as access to meaningful broadband. So where a patient can either access in their home, outside of their home, and of course maintain something that is strong enough for a telehealth visit or other resources. So what we have currently set up is a Wi-Fi, long-range Wi-Fi infrastructure. On the right-hand side of the picture here, you'll see what is the current coverage, and that's our entire campus. So we're looking at expanding our community Wi-Fi initiative beyond our health center down to the coast. And what's started there, HBOM, that's an affordable housing complex that we hope to offer community Wi-Fi and incorporate the ACP outreach, our outreach activities and funding to that location. This is the Kupuna computer training courses that we talked about. What I really want to emphasize here, obviously, is that our Kupuna, we're super excited. Our eldest on the top left, 91 years and young. On the right-hand side, our Kupuna, first time ever turning on a laptop, first time owning a laptop, and first time ever joining a Zoom. So you talk about applause and just, you know, everyone being so excited to be, to connect to the outside world, something I think that all of us on here probably take for granted. The other thing that I want to emphasize really is partnerships. All of this that we're doing, it's not just Waianae Comp. So really the key is looking at who your partners are, who they could be potentially, who are out there with the same passion, the same mission, the same goals that you have in terms of digital access, digital literacy, closing that digital divide. One of our partnerships with Lanakila has even expanded, where we are now a partner on their community activities event calendar. So this is island-wide, super exciting. Who you see here is Verna Chung. She's our director of citizen support. She volunteers twice a week. Her time as a yoga instructor for chair yoga. The bottom left-hand side, so it's a hybrid model. You have those Kupuna who are accessing from home, as well as at an assisted living facility where the Lanakila staff get those folks connected. I'm going to turn it over now to Leina to talk a little bit about our ACP program outreach.
Right, so I'm sure all of you are familiar with the Affordable Connectivity Program offered by the federal government. So our LLC that we just formed maybe about 2 years ago, called Elepaio Social Services, was one of 2 awardees here in Hawaii. And as mentioned earlier in our slides, you know, the socioeconomic status factors, risk of our patients really have a huge impact on their lives. So when this grant it came out, we knew that this was something that we really needed to get on, you know, because this really promotes the affordability of the internet connection. And so the goal here of the grant of our program is really just to increase the awareness of ACP in our population and increase the number of people enrolled across our community. So we've begun promoting ACP at various community events, and we're gearing up for more. We're really reaching out to our community partners, our community social service partners, and trying to see what we can piggyback on each other in promoting this service. And our plan is really to reach those unconventional events, such as like bingo nights in our community, where a lot of our Polynesian members congregate at weekly. Sporting events, we have a lot of events on the coast for kids, parent clubs, as well as the 4 homesteads that we have here on the Leeward Coast. So homestead is something that you would compare to a tribal land on the mainland, where these are parcels of land that is dedicated for those who are 50% Native Hawaiian. So we have pretty big communities of these homesteads here on the coast where they can take part of this and receive up to $75 towards their broadband service. So we're really excited about promoting the ACP in our community. Another initiative that we are taking part is our remote patient monitoring program. We've linked up with the vendor to begin providing these kits that you see here to a small cohort of patients. And so each day in their home, these patients will be able to use the tablet and the devices to transmit symptoms and vital signs data over to our vendor. And then it's submitted securely to the clinical team within seconds. And then the patient's data is then analyzed and provided, the information is provided to their care team. And then if there is any adverse vital signs or adverse symptoms, then the information is brought over to us immediately. And then our team of nurses are providing round the clock, not round the clock care, but are on call round the clock, will be able to either adjust their care plan under the supervision of our providers or do any kind of education or referral to the emergency room. So with that, these patients have a multitude of useful features right at their fingertips, such as educational videos and quizzes, nutrition information. They can hopefully eventually maybe video chat with a nurse, care plan reminders, and medication reminders. So we're excited to begin this cohort here. Chrissy?
So Compounds Connect, this is something that is in development. I had mentioned in our strategies. So just to give you an idea of really what we're working towards, our initial implementation will really focus on LPIO services, our social services that Leina had mentioned. So one portal where our community, so not just our patients, but our community can go to find the whatever resources that they need, as well as for our patients, so a medical care portal. And then we look at expanding to community partners, news events. For us in Hawaii, is the Surf Up, so a surf report, and then high school football, what is the schedule? So really a wide variety of information in one portal. This is really the exciting part. I know that we're winding down to our time, but I really want to make sure that we get through this. I'm going to turn it over to Leina to highlight what we're doing in the AI world.
Right. So lots of work that we're doing in the AI world. So just kind of taking a couple steps back, in our early attempts to manage the cohorts or our population that we have here at the health center, it was really difficult in, I want to say our early days, but those early days is not so long ago. We have as you know, we have complex patients, multiple comorbidities, behavioral health conditions, SDOH factors. And we started our work with our Medicaid plans and really identifying on our high ER utilizers, those that were doing repeat readmissions to the hospital. We really focused on our most costly patients, and we had adopted ADT fees. We're using that. We also noticed that there is a lag with claims-based data, and we've noticing that we've been reactive versus being responsive, and virtually, ultimately we're just really chasing our tail with these most costly patients. So we came across this company called Foresight Health Solutions, who their model really is to predict the risk and promote that optimal health interventions for our vulnerable populations. And they really do this by collecting data from diverse sources. So that could be from our EMR, from our case management notes that really much people don't tend to take note of are SDOH surveys, claims data, BH notes, prescription information, inpatient transitions information. And what they do is they take all of that, they use their proprietary models, their AI analytics machine, we like to say, and what they can do is accurately predict their health risks, the costs, the adverse outcomes, and the health disparities of our patient. But what most importantly is that they identify the most effective actions that we can take as case managers to mitigate and reverse those health outcomes and even produce cost savings. I'm so sorry for the noise. I'm underneath our cafeteria and it sounds like a party is going on upstairs. So studies have shown that 20% of a patient's health and well-being is really driven by the access to their medical service, the quality in the medical services. The remaining 80% is really driven by their social determinants of health. So this includes, our behavior, where they live, and their environment and so forth. So Foresight, what they do is, like I mentioned, they take these factors as a starting point to kind of evaluate the patient's comprehensive risk score and their health status risk. And they give us the most accurate prediction of the risk for the patients by synthesizing all of these data points. And so they're able to pinpoint the individuals that require various levels of care. They're looking for those high-risk patients who would most benefit from a specific service or a specific intervention, and identifying that most impactable care services at both the population level and the individual level. So in other words, giving us that prescriptive analytics. So this type of precision care for our care coordinators and our community health workers have really been shown to kind of just enhance that effectiveness of our program's overall experience. So in March of 2021, we entered a value-based contract with 2 health plans here in Hawaii, where we identified and agreed upon cohorts with both plans. So roughly about almost 2,000 members. Baseline risk levels and cost measures, costs were measured for both of the cohorts. Sorry, excuse me. And then the monthly claims were combined with that EMR data, and it was analyzed to kind of give our care team guidance along with the Foresight tool, and to just kind of help us monitor our progress. So our experience in that first year was, first of all, we saw an extreme amount of SDOH risk contributors. The workflow, just to give you a small detail, was our care team would reach out to the patient, complete the SDOH or the Prepare tool that Chrissy had mentioned, and all of that rich data, along with all those service codes that we capture, that Chrissy had shown earlier, is embedded into our EHR. And so Foresight is pulling all this rich data to help us put together these risk factor models for us. And so you see here, these are SDOH risk contributor factors we found. Rates of unemployment, homelessness, those living alone, those with food issues. Next slide. And these here are medical risk contributors that Foresight had found in their analysis, those with depressive disorders, obesity, COPD, schizophrenia. So lots of stuff that they're pulling from our EMR. The next slide goes over our natural language processing. So one of the key features of Foresight was they were able to go into our case management notes, as a lot of it is just free texting. Our EMR is not designed ultimately for a case manager like our staff. So what Foresight did was they're able to go into our case management notes and kind of looked at those locked away EMR notes. So for this slide here, our codes or our data from our SDOH surveys would show us what you see here in the blue. That came straight from the surveys or the codes that our staff use. But what you see there in the green is information that came from the system reading our staff's notes. So for instance, if a staff put in their notes living in a tent or sleeping at the beach, the tool was able to pick out key words in the staff's notes to say, hey, you know what, this patient might be homeless. because note after note, there's a talk about a blue tarp or living in a car or on the sidewalk. And so what this the tool was able to expand or show us there's so much more people who are experiencing homeless than just what the survey provides. And we use that and natural language processing had pulled out language for other social risk as well. This here showed us the savings due to our enabling services. So for let's go with crisis stabilization. So if we had performed a crisis stabilization on a patient, the cost savings annually for that patient would be about $1,100. So the Foresight model was able to pull out what kinds of particular interventions and what is the predicted cost savings for that patient annually, monthly, and pre-monthly. Next slide. Our work with both plans consisted of work for 1 year. It's a 1-year project, and we used our care coordinators, which are nurses, and our community health workers here at the center to really do some really great work with our teams, with our 2 cohorts. So for the health plan A, the cost savings for this cohort was about $1.7 million, which is an extreme amount and an admirable amount of cost savings. So when we look at cost savings, I should back up a little bit. We look at the baseline period and then the study period and what was the cost of this cohort in those 2 time periods. So from 13, we went down to $11 million. Next slide. And then same thing for cost for Health Plan B, the change in cost was about another $1.7 million, from $7 million to $6 million. So we're really proud of the services that our staff have been able to provide with the assistance of the AI-based formularies, where Foresight is able to provide to us prescriptive analytics. Our care team takes that back, inputs that prescriptive analytics, and then every month we're looking at claims, we're looking at cost levels, we're looking at all these unconventional data sets that helped guide our care management teams into the work that they're doing today.
Mahalo, Leina. So really what we're looking at is our own value-based care model. And this is something that Leina and other folks on our executive team are presenting really all over the nation, because we know we've known this all along, but now with AI, we're able to prove that what we do in terms of enabling care services, all those integrated services really do contribute to not only improving healthcare outcomes, but also a cost savings. Thanks, Leina. And so this is our last slide. I know we're at the end, but I think this is really telling in terms of our patients' experience and their perspective of the quality of care when it comes to telehealth. This was our results of our Q1 for this year. Since 2020, we incorporated telehealth connectivity in our patient surveys. And so these surveys are conducted by a third-party vendor that we use, and they call patients and ask about their experience. This is the first time, if you look on the left-hand side, the blue line represents our televideo visits. So our telehealth visits are separated out into telephonic, televideo, and then the in-person is the black line that you see there on the graph. This is the first time that televideo has, in terms of satisfaction, when you look at overall satisfaction in courtesy and helpfulness, provider listening, provider explanation, provider knowledge, or at least the patient's perspective, provider knowledge of health history, and then just over quality of care, televideo scored higher than the 2 other modalities. And then on the left-hand side, just down at the bottom, when we look at ease of connecting with the care team, this was the first time that our televideo experience ended up being better than telephonic in terms of connecting. So I think we feel happy that what our efforts, we know it's making a difference, but we also know that our patients who can connect and who have connected expect that service line or that access to care will continue even in this post-pandemic era. We thank everyone for your time, and I tell you, we could go on forever, but I see that we are at the end. And so I hope we have some time for questions.
Mahalo so much, Chrissy and Leina. That was fabulous. I'm having people texting me how impressed they are. I mean, every section of your presentation could have probably split out into an hour in itself. We do have a question from Dan Smith and asking, how would you quantify the benefits of telehealth, both outcomes and cost reduction? I want to just kind of talk about this question a little bit because you presented so much on how Waianae is using data to improve care. You talked about telehealth adoption data, which is unique. I know that you got it in the level of detail that a lot of providers don't actually collect it in that. You just talked about here in terms of satisfaction. So that's satisfaction piece as well. I wanted to know, do you collect data or how do you measure, I guess it's what Dan's question is, how do you measure it in terms of the benefits for outcomes and cost reduction, and specifically for telehealth? So I know, Leina, you covered the social services and taking that high-risk population. And maybe it's not easy to break out because it seems from your presentation that it's holistic care for improving health and wellness is what Waianae does. And so maybe you don't break it out that way, but I'll turn it over to you to see if we can address Dan's question.
Sure. Hey, Dan, thanks for the question. I appreciate that. And actually, it's very timely. We're super excited because thanks to Christina, we have been in discussion with UMMC, so University of Mississippi Medical Center. They are a HRSA telehealth Center of Excellence designated site. And so with their help and their wealth of knowledge and expertise in the research realm, we actually did a study with Foresight Health Solutions between 2021 and 2022, Leina, if I'm not mistaken. It was a year-long study. We had about they looked at over 14,000 visits, but really what that study was a hybrid care model. And so we looked at 3 different modalities. So in-person only, in-person with a telehealth visit follow-up, and it can be multiple. And we broke those telehealth visits into televideo and then telephonic. And so if you look at if you think back at the slides of why patients would end up being telephonic, then you'll know why we have that modality. But I think the very exciting thing is the outcome that we knew that telehealth benefits, but really what this shows, and we actually submitted an abstract on it, so hopefully we'll be selected, was that the hybrid model in terms of in-person with a telehealth visit follow-up for both, whether it's telephonic or televideo, experienced in all improvements in the health quality measures that we had selected. So if you're familiar with HQMs, that can be for preventative or disease monitoring, all except cervical cancer screening, which requires obviously that a female goes in and sees their provider. But we not only experienced better healthcare outcomes for that cohort, but also cost savings. And so that's very telling. We're super excited about that study and hope to share that with others.
Thank you so much, Chrissy. I see Aria's video came on, so I don't know if that's an indication that we need to take the last 3 questions. Okay. So with that, we have last 3 questions. We will definitely take them and we'll respond, or Leina's trying to respond live right now. I want to thank all of you for attending, especially to our speakers, Chrissy and Leina. What a wonderful presentation. Very exciting, generating a lot of questions and comments. So with that, I'm going to thank everyone and turn it back to Aria for closing session.
Thank you, Christina. Just a reminder that our next webinar will be held on Thursday, August 17th, and that will be on the Crystal Ball Project, the Telehealth Technology in 3 to 5 years, and that will be hosted by the Telehealth Technology Assessment Center. Registration information is available on the NCTRC website. And then lastly, we do ask that you take a few short minutes to complete the survey that will pop up at the conclusion of this webinar. Your feedback is very valuable to us. Thank you again to Chrissy and Leina for their presentation and to the Pacific Basin Telehealth Resource Center for hosting today's webinar. Have a great day, everyone.
Aloha, mahalo.